The following video provides an overview of the general specimen collection procedure for the rural study. Refer to the most recent study MLP for complete and up-to-date and in-depth instructions. Prior to phlebotomy or any physical activity, have the participant collect their urine sample. Set the urine aside in a refrigerator until further processing. Prior to the phlebotomy, ensure that the collection cart is well stocked and organized with any materials that may be needed during a phlebotomy session. These include, but are not limited to, PPE, smelling salts, extra draw tubes, a sample rack, and various bandages available depending on participant preference. For a complete list, see Section 3.2 of the Manual Operating Procedure. While the participant is collecting their urine, prepare the materials necessary for their blood draw. Pre-label the draw tubes and arrange in the order of the specimen draw: serum, EDTA, and then the PAX gene. After becoming familiar with the vein anatomy of the arm, target the median basalic vein, the median cubital vein, or the median cephalic vein as the collection site. Individual vein locations and directionality vary greatly. It may be beneficial to apply the tourniquet, find and remember a good spot, and then remove the tourniquet while preparing the butterfly and other materials. Once ready to begin phlebotomy, apply the tourniquet and wipe the area with alcohol in a circular motion and allow to dry. Start the timer while the alcohol is drying. Firmly anchor the selected vein with the thumb and forefinger and insert the butterfly needle at a slight angle. Ensure the needle is securely placed and insert the first draw tube, serum number 1, into the lural lock. Allow the blood to flow into the draw tube at an angle such that it flows down the side of the tube. Once the first tube is finished, remove it and add the next tube. For the EDTA tubes, gently rotate and rock the tube to ensure complete anticoagulant mixing. Alternately place on a rocker for 30 seconds. For the final tube, the PAX gene, take care to avoid any retrograde flow back towards the vein. The preservative is toxic. The tubes should be held below the level of the participant arm while filling. Remove the tourniquet and stop the timer. Be sure the last tube is removed from the lural lock adapter. Place gauze over the phlebotomy site and remove the needle. Immediately discard into the sharps container. Have the participant hold the gauze on the phlebotomy site while elevating the arm for at least 30 seconds. Apply the bandage selected by the participant. Note any pertinent information on the designated phlebotomy forms, including the duration of the draw. Ensure that EDTA tubes number 5 and 6 have been placed on wet ice until processing. All the other tubes remain at room temperature. Continue on to the specimen processing video for further instructions.